Hello everyone, welcome back to my YouTube channel. So today we'll be discussing screening, a very short concept in community medicine. So we start with what's an iceberg phenomenon, then we move on to the concept of screening, and then screening versus periodic health examinations, and then screening tests versus diagnostic tests, which is a very important table. And then we discuss what is lead time and then screening time, which is shown in a good diagram. And then we see the aims and objectives and the various outcomes of screening. Then we discuss few terms. Oh, so what is screening exactly? It's when you test individuals who are not seeking healthcare for a particular disease. Case finding is when you do the same thing for individuals who are actively seeking healthcare services. And then we discuss the definition of diagnostic tests itself. Then the use of screening are as follows. We use them for case detection or prescriptive screening, and then for disease control it's known as prospective screening, and then also for research and educational purposes. The types of screening are mass screening, high risk screening, and multiphasic screening. Then there are various criteria to consider a disease to be suitable for screening activities. Firstly, it should be a known and important health problem of at least reasonable concern. Then it should have a recognizable latent or asymptomatic stage. Its natural history must be well known. There must be tests in place to detect the disease prior to the onset of signs and symptoms. There should be adequate facilities to confirm the diagnosis. There must be an effective mode of treatment, and there also must be a policy for treatment in place that's agreed upon by various healthcare professionals at various levels of the healthcare system. There must be good evidence of decreasing mortality and morbidity with early diagnosis. And of course, the benefits of screening must outweigh the risks and costs. So any screening test for that matter must satisfy the criteria of acceptability, repeatability, and validity. Repeatability of a screening test is influenced by various types of variations, in which you have inter-observer variation and intra-observer variation, and then biological or subject variation and technical variation. And then there are various criteria for validity of a screening test, like sensitivity, the ability to detect true positives; specificity, the ability to detect true negatives; predictive values of a positive test and a negative test; and percentage of false positives and false negatives. Predictive accuracy also refers to the predictive values, plus what is yield and a small note on combinations of tests. Then we discuss the concept of borderline across bimodal and unimodal distributions. So bimodal distribution is when you have a normal curve followed by a curve for the deceased. Usually they can overlap, and I'm marking few points here. The E is where they intersect, and A is and B is the borderlines respectively for bimodal. Now for the unimodal distribution curve, normal values in the center, I'm going to mark points C and D, and everyone beyond D is deceased. Now coming to the bimodal curve, we consider E as a cutoff point. So if you shift the cutoff point from E towards A, that's basically leftwards in this curve, you would increase the sensitivity and the cost of decreasing the specificity. However, if you shift it towards B, you will increase the specificity, but you'll also reduce the sensitivity at the same time. So this basically discusses the gamble between sensitivity and specificity, which is more important. So the real answer is that both of these are equally important, and the textbook explains using diabetes as an example how both are equally important. So to determine a cutoff point, we considered the prevalence of the disease and the severity of the disease. Then there's a small table showing screening tests for pregnancy, infancy, middle-aged, and the elderly. Would be a bit useful for short answers. And then we see the evaluation of screening programs using RCTs, randomized controlled trials, uncontrolled trials, and other methods like case control studies, and comparing the areas with different degrees of screening coverage. So that's it for today, guys. I hope this was helpful. Thank you for watching. Any suggestions, please comment down below. Like, share, and subscribe. Thank you all once again.